Everyone, I am Lama Shatri and today I'm going to talk about hemophilia. What is hemophilia? What are the causes? Is there a treatment? This is what I will answer today. First, let's start with the word hemophilia. If we broke the word hemophilia, we will have two words, hem and philia, which means blood and love. A way of saying that people with hemophilia love to bleed, or rather it's hard to stop bleeding, and this is because of the impairment in hemostasis, which is a process to stop bleeding. So that's a general idea about hemophilia, and to be more specific, hemophilia is hereditary bleeding disorder caused by lack of some clotting factors, and this can lead to a heavy bleeding. This disorder is inherited in an X-linked recessive manner, and its effects differ from males to females. In females, there are two X chromosomes, one from their mothers and one from their fathers, and if we suppose that the mother has hemophilia, the daughter will have a healthy X chromosome from her father, but the other chromosome is carrying hemophilia, so she will be a carrier. On the other hand, the son will have hemophilia because he has only one X chromosome and it's from his mother, and this is the reason why hemophilia affects males more than females. The diagnosis will be a performing physical examination, and if the person has symptoms of hemophilia, the doctor will ask about his family's medical history since the disorder is genetic. Also, blood tests are then performed to determine how much the clotting factors are present. Now let's talk about the types of hemophilia. We have A, B, and C. A is the most common type and is frequently referred to as classic hemophilia. B is the most common type in the Arab world, and C is the most rare type. The causes are, like I said before, hemophilia is caused by lack of some blood clotting factors. The first clotting factor is 8. Lacking this factor causes hemophilia A, and lack of factor 9 causes hemophilia B, and lastly lack of factor 11, which causes hemophilia C, and below each cause a picture of each clotting factor. The symptoms are nosebleeds without a known cause, unusual bleeding after vaccinations, blood in urine, and pain or swelling in the joints. Hemophilia can cause serious complications, for example, deep internal bleeding or bleeding into the brain, which can cause a stroke. Also, infections. One of the largest therapeutic problems during the continuous treatment of the patients with hemophilia A and B are viral infections as hepatitis B and C, which can be transmitted by the transfusion of blood products, as well as damage to joints, and it's happened because the internal bleeding puts a pressure on the joints. The treatment depends on the type and severity of the disorder. We have the main treatment, the replacement therapy, which is injection of missing or non-functional clotting factors, and the treatment can be derived from human blood or it can be produced in lab. Then other treatment is physical therapy, which can ease the symptoms if internal bleeding has damaged the joint. Now the question is, can we prevent hemophilia? No, because it's genetic, but people can get genetic testing to see if they are carriers or not before having a baby. The prognosis of people with hemophilia is expected to be normal as long as they know about their condition and have a treatment. And the most life-threatening complication is bleeding in the skull or internal organs, so the death rate is about twice that of the rate of healthy people. Some of the preventive measures of hemophilia are to exercise regularly, avoid certain medications such as aspirin because it adds problem with bleeding, and get medical alert bracelet. Take-home message: hemophilia is an inherited bleeding disorder and it has 3 types, A, B, and C, and also it may have serious complications that may lead to death, and the treatment depends on the type and severity. Also, there is no way to prevent hemophilia, and lastly, there are some preventive measures for hemophilia. In conclusion, this presentation discussed 5 key areas of hemophilia: the definition and types, symptoms, the causes, the complications, and finally the treatment. Here we have the reference that I used, and finally I would thank you for listening. I hope you enjoyed the presentation. Thank you.